We are continuing the discussion on COVID-19 and the vaccine and the importance of staying informed. As you ask, we answer.
Yeah, we're joined once again by Trinity Health of New England's Dr. Syed Hussein. Dr. Hussein, good morning. How are you today?
I'm fantastic. Thank you.
And glad to have you once again. And once again, we want to talk about Pfizer here. It is now officially seeking emergency use authorization for its vaccine in kids aged 5 to 11. There's been a shifting timeline as to when these shots could roll out if that authorization is granted. Where do we stand with that now?
So first and foremost, this is very exciting. It's another positive step in the right direction to put an end to this pandemic. We anticipate the advisory committee of the FDA will look at the data that Pfizer submitted towards the end of this month, followed by CDC's advisory committee on immunization practices that will then weigh in, and then hopefully we'll be ready to go. So we're probably looking at either Halloween time or right after, so early November, end of October timeframe.
Doctor, can you talk a little bit more about the dosage? Because that seems to be one aspect of this that is very concerning to parents.
So I want to start off by saying that both Moderna and Pfizer, the mRNA vaccines, and Johnson & Johnson for that matter, are extremely effective and very safe in the adult population. What Pfizer has submitted to the FDA is basically a third of the adult dose. So hopefully, with vaccines, we always try to go with the lowest dose possible that will confer the best protection with the least amount of side effects. So we look forward to reviewing the data, but for concerned parents out there, suffice to say that these vaccines in children will be safe and effective because the FDA will make sure that they pass muster when they are scrutinized.
Okay, I'm curious if this authorization goes through, doctor, and a substantial portion of kids age 5 to 11 do wind up getting vaccinated, what impact, if any, that will have on mask rules at schools? What do you think?
So as of now, keep in mind 12 and above can get the vaccine, yet from K to 12, the CDC does recommend, regardless of your vaccination status, indoor masking is required. So eventually we'll get to a point when more and more children, after the authorization gets to the 5 to 11 year age group, I do believe that we'll get to a place sometime next year where these masking rules will be relaxed. But till then, it's really important that folks continue to ensure their children are masked in the indoor school environment.
And Doctor, curious what your thoughts are on how the vaccine mandate and required testing is going to play out with new workplace and business requirements.
Sure. So we've seen Trinity Health was one of the largest healthcare systems in the nation to mandate, require healthcare workers to get vaccinated. It's the right thing to do. Safety is our topmost priority, and we want to ensure that our patients and our community have a safe environment of care. Now, having said that, we've seen the mandate being now rolled out to other healthcare systems across the nation, other industries. So we'll see more and more of this happening. Testing, on the other hand, we do expect with the federal government's announcement of $1 billion towards at-home testing, that will really help because it's another important tool, especially when you're about to travel, you're going to see a loved one who may have medical comorbidities, or you're planning a gathering. It's really quick and easy to get one of those rapid tests. We do expect more tests to be available as the winter time draws closer.
That is something that some epidemiologists have been fighting for now for the better part of a year and a half. So it would be good to see that come to fruition. Doctor, thank you so much for taking the time to join us once again, and we will see you next Friday.
Thank you for having me.